In Chapter 6, I will talk about the next steps and making sure that you are prepared for surgery. So what should you be doing to prepare for surgery? We do recommend weight loss as you go through the pre-op process. If you're taking a prescription weight loss medication at this time, we would like you to please stop. We want to make sure that you're able to produce weight loss based on your dietary and behavior changes and not on a medication. We want you to start taking the vitamins and mineral supplements discussed in the previous slides. We want you to be abstaining from alcohol and avoiding any carbonated beverages. We want you to be working on reducing or eliminating your caffeine intake. It's not a bad idea to clean out your cupboards and refrigerator. If there are more tempting high-calorie foods that are harder to stay away from, maybe they don't belong in the house. We also want you to be working on increasing your physical activity. Remember, the goal is to aim for 30 minutes per day, but start wherever you can. If you have diabetes, this does need to be in relatively good control. What we're looking for is an A1C of 8% or less, which would be equal to average blood sugars of 180 or less. And before having surgery, we would like for all patients to attend at least one support group, and our support groups are now offered both in person and online. It is possible that we will give you a weight loss goal during the pre-op process. You can see here on this slide that this weight loss goal will be based on your body mass index. Your dietitian will help you calculate your weight loss goal upon entry to the program. Marijuana use. We do tolerate the use of edible marijuana products or topicals in our program, but do not recommend them overall. Remember that marijuana in the form of candies, cookies, brownies, and other high-calorie baked goods will not be conducive to weight loss. It is very important to be aware of the calorie content of your edibles if you use them, and to choose lower calorie options as often as possible. At your individual dietitian appointments, we will go into more detail on the diet specific for you, but a few general tips to start with include the plate method. The plate method can help you determine appropriate portion sizes for a balanced meal. Letting a 9-inch plate be your guide, fill half of the plate with non-starchy vegetables. So vegetables such as broccoli, salad greens, green beans, Brussels sprouts. Those are all considered non-starchy vegetables. 1/4 of your plate can be filled with a low-fat or lean protein food. Ideally, you want to weigh this out to 3 ounces cooked, which would be roughly the same size as a deck of cards. On the remaining 1/4 of your plate, you can have a serving of a starchy vegetable or a healthy whole grain, such as a brown rice, whole wheat pasta, or quinoa. You should measure this out to 1/2 cup. It is also important to keep in mind condiments, and they are not calorie-free, so try to avoid high-calorie condiments as much as possible. This slide covers what you should be working on for your next appointment with the dietitian. We would like for you to purchase your multivitamin and calcium supplement and bring these with you to your in-person dietitian meeting. Complete any homework assignments or quizzes. We will be looking for you to show weight loss toward your designated goal. If you're making positive lifestyle changes, such as healthy eating and daily activity, this should be helping to promote weight loss. Review the Northern Light Surgical Weight Loss Education Manual, which will be provided at your first visit, in-person support group, or is also available online. You can bring one support person with you to this appointment as long as they are not also going through our pre-op process. Watch the online physical therapy class at northernlighthealth.org/SWL-physical-therapy. If your local grocery store has access to a registered dietitian, this can be a great resource to help you get ready for surgery. This slide covers some tips on how to maintain long-term weight loss. These tips are what we like to call ingredients for success. It is important to come to all of your appointments both before and after surgery. Missing appointments before surgery will only delay that surgery date, and research shows that patients that check in with their care team periodically after surgery stay on track better. Be open to suggestions. Work on eating your protein first at every meal. Avoid meal skipping. Avoid grazing between meals. Avoid any type of high-calorie beverages such as juices, soda, and alcohol. Eat slowly and chew thoroughly. Avoid any high-calorie foods such as fried foods and sweets. If you need help, ask for it. You can call our program at any time if you have questions. Be working towards daily physical activity, and make sure you're thinking about this as a lifelong behavior change. Weight loss surgery is not a very quick fix. It is a lifelong commitment. So this concludes today's presentation. The following chapter will include a quiz to assess your knowledge on the information that was just covered. If you have any questions, these can be addressed at your next dietitian appointment. If your questions are more immediate, you can call our program at 207-973-6383. Thank you for joining me today, and I wish you the best of luck on your weight loss journey.